Hi, everyone. Thanks for tuning in to the Buzz Podcast. And it's been a while. I'm excited to be back. Last year, we spent many weeks together getting ready for the patient-driven payment model. And I've spent the first quarter of 2020 reviewing our outcomes under the new payment model, which is exciting and got some great information to share later. But as you all know, we are in the middle of a global pandemic. And for those of you new tuning in, welcome. My name is Casey Lee. I'm a doctor of physical therapy and on the quality team with QRM, Quality Rehab Management. And this podcast last year was dedicated to healthcare providers, preparing for PDPM, healthcare providers who serve aging adults. And wow, healthcare providers across the world, you're heroes, and I have no words. I don't have the words to tell you. I hope healthcare providers are listening and hearing this, and as many people out there as possible can just tell you how much we admire what you're doing and thank you, and you are essential. And I think that's the title of today's first podcast of many. We're going to be pushing out a ton of content over the next few weeks, few months, giving you and your therapy teams, your entire teams, and skilled nursing facilities and long-term care facilities, tangible resources to use in this global crisis. And of course, it's changing every day. So subscribe to the podcast and stay up to date, because whatever today is, March 18th, whatever happens today, it could be completely different in a couple episodes. So stay up to date with the podcast, subscribe, reach out to me, and let me know what's going on in your buildings. Let me know what you're hearing. We want to hear from you and be able to share your stories on the podcast. But for those of you that are new, again, welcome. And the topic today is we are essential. And I'm talking to the therapists out there, the physical therapists, the occupational therapists, the speech therapists. Y'all, you are in there, right? We can't keep a 6-foot barrier between what we do and our patients who, oh, by the way, the patients that we serve at the center of this pandemic, the most vulnerable population. I mean, there's a person in the middle of this, and they're not in a great shape to begin with. They are coming to us after being in the hospital, after fracturing a hip, after having a wound and infections. They are not in a great spot to begin with. They're sad, they're scared, they're isolated, they're depressed, and now we have a whole new slew of fears to just introduce into their already very scary world. And a lot of times the therapy teams, the PTs, the OTs, the STs, like we're supporting them because we can spend the time. Like, we've got dedicated amounts of time that we can really spend hands-on talking with them, talking with their families. We provide that comfort, that touch therapy that they need to be able to get through the skilled stays while they're in our nursing homes. So, we are essential therapy providers, and there's a patient at the center of this. These are two very important concepts that it just really stuck out to me when I was putting together material for today. But I want to go back to we are essential because CMS made the right call by limiting the non-essential visitors and healthcare providers. And I want to be clear, because we started getting questions about whether or not our teams were essential. I was kind of shocked. We are essential therapists, you are essential, 100%. No one can do what you can do. We can provide the skills and strategies with functional mobility, with communication, with ADLs in a safe way to contain this thing. Like, we are not just here, we're superheroes. We're in such a great position to do some amazing things. So we are absolutely essential. Don't let anybody tell you that you're not. You are essential. But please protect yourself. Protect yourself. Protect your patients. Protect your families. Follow the CDC's guidelines. And, oh, by the way, the CDC's website, I've never spent so much time on the CDC's website in my life, and as much as I have in the past week. So much great information for everyone, but healthcare providers. There are dedicated materials for you. Check it out. Like, spend some time, dig in deep. I mean, you just keep clicking away, and there's just resource after resource. I am amazed at how they pushed out so much information in a short period of time. So check it out. That is the place to be for up-to-date information on this thing. But protect yourself. Wash your hands. We are going to follow every single one of their recommendations to protect ourselves and protect our patients. Of course, washing the hands. Wash your hands. And guys, disinfect your equipment. One of the great joys in my role is getting out and meeting and visiting with therapy teams and talking about their outcomes and meeting with nursing home administrators and nurses and MDS coordinators. So I'm in there. I know what your gyms look like. I know it. Clean it up, please. Everyone take a corner and deep clean, get rid of the junk, sterilize, and practice the disinfecting between every single patient. And really consider, not even consider, and I'm going to dedicate a whole podcast to this concept alone. We cannot have the same scheduling practices that we had 2 weeks ago, a month ago, today. Meaning, those heavy traffic times in our therapy gyms, that cannot happen. The 6 foot rule doesn't even, it mathematically doesn't make sense. So we have to be spreading out our treatments. We have to be adopting in-room treatments for those risky patients. We'll talk about that. And more often than not, getting into the rooms and keeping people separated, keeping that 6 foot barrier. But you can't do it when all of the patients and therapists are working in the gym between 9:30 and 12 and 1:30 and 4. I know what the behaviors are because I've been a physical therapist for 14 years, 10 of which have been in long-term care. I know what the whole pattern is. I know what it is. It can't happen. Okay. So clean up the equipment, start spacing out those treatments if you haven't already, and clean up, sanitize, disinfect in between each patient. Follow, safe coughing strategies. I mean, you go to the CDC's website. We all know this stuff. We've been hearing it over and over again. So follow those guidelines and protect yourself, protect your patients, protect your families. And over the next, it's going to be more than every week. Over the next few weeks, though, check out the podcast. You should be getting alerts whenever we update and send out more content. But I'm going to be sending out treatment strategies, scheduling ideas, how to change and adopt your treatment plans in the middle of all this, right? Because our therapy goals, our skilled therapy goals, are going to look different because we're really going to be focused on the essential goals, the essential functional activities versus dynamic balance and fine motor coordination. I mean, that stuff, while incredibly important, is not essential right now. We have essential goals that we need to address, and I'm going to be helping by providing some guidance on how to write those and what those treatments might look like. Telehealth, y'all, they have allowed for the provision of telehealth for under Medicare, there are some rules. I've got some different education seminars coming up that I'm going to attend, and I'll share all of that content with you as soon as I have it. But it's exciting. That is exciting for us. I think it's a great way for us to work top of technology and top of license. And, now in this new world, to do it safely. We have a lot of scared people out there that are, maybe thinking that they want to discharge early when they're not safe, and we know it's a disaster waiting to happen. Telehealth might be an answer for us to be able to stay connected with those patients for a few more visits and ensure that a bad situation doesn't turn into maybe a fatal situation if they go home and they fall and they don't have the support that they need. So telehealth, it's exciting. There'll be more to come on that. So back to our topic of the day, we are essential therapists. We are essential. And what I want to talk about today, when I was thinking about how I wanted to launch this series, with the things that we're going to have to do to contain this thing, right? We've got to socially distance. We've got to isolate our patients. We've got to keep people away from each other. And guys, your high-risk people should be top priority for you. Who are they? They are your patients. Of course, older patients are high risk, so all of our patients qualify for that. But then you should absolutely know who is on your schedule, who has heart disease, lung disease, and diabetes. Those are high risk people that you absolutely want to protect and keep them away from other people, treat them in their rooms, find alternatives to bringing them into the gym during this time. But I think it's very important that we recognize that in order to do the things we have to do, right? Like we have to do these things to contain it, to contain coronavirus and keep it from spreading around everywhere and impacting our people, our population. So we've got to do those things, but there's consequences, like big major consequences that could have an impact on our patient outcomes, quality of life, patient satisfaction, also incredibly important things. Like we can't just, follow the guidelines and not treat our patients and nobody gets better. Like we can't do that. That can't be the answer. And so I think it's really important that we own the consequences and try to address them as best we can with the way that we're writing our goals and the way that we're delivering our therapy services. Our therapy delivery model is going to change. It's going to change to address these potential negative consequences. So, by restricting people to their rooms, their mobility will go down. That is institutionalizing dependence right there. And there are consequences of social isolation, and there are consequences of reducing physical activity. Just to name a few, guess what? High blood pressure goes up. Risk of heart disease goes up. High blood cholesterol goes up. Obesity, type 2 diabetes. How many of those things also contribute to the risk factors of coronavirus? So it's just a vicious cycle, y'all. So not moving it's going to cause a slew of problems too. So just being aware that the risks of physical inactivity are going to contribute to this. Risks of certain cancers. There's a whole list of cancers that the risk goes up when we are immobile and not getting regular exercise. And then the social isolation piece. When in studies, they see that with social isolation, and again, all of these resources that I'm discussing are either from the CDC's website, which I've got resources and website materials for you, which I'll include in the podcast notes. And then also the National Institutes on Health. So the NIH and the CDC is where I'm getting all this information. So social isolation can increase your risk of a weakened immune system. when I was reading through this, I know all this stuff, but it was when I was putting together everything, I was like, well, goodness gracious, we are just setting ourselves up for a even bigger disaster. It's already disastrous proportions, and with the things that we're going to have to do, if we don't just recognize it, own it, create strategies right now to address it, it could be even worse. Social isolation also, I think, makes sense. Anxiety and depression goes up. We already have people terrified, scared, anxious, and depressed. Well, guess what? If they're not getting regular exercise, they're not getting the exercise response, that nice feeling you get after working out really hard and achieving a goal, well, now we're just going to be even sadder and more scared and more anxious. Cognitive decline. So those people that are impulsive and make bad decisions because they're cognitively impaired, well, guess what? If you start keeping them, if you institutionalize the dependence, keep them in their rooms, not let them walk around, not let them get their exercise because we're trying to protect them from spreading infection, well, now you've also got an increased risk of worsening cognitive impairment and more safety and behavioral issues. So get fired up for that if we don't have a solution for that. And then in some cases, even death. So social isolation can be deadly. And again, these were all items that I found on the CDC's website on social isolation. So on the flip side, we are essential therapists, superheroes. The benefits of physical activity are so clear, and they support the need for us, right? We are essential. We're going to create those essential goals. We're going to do everything we can to contain this thing, and we're going to do it while also supporting and enhancing our patients' abilities to be active, to get the exercise that they need, to stay healthy, to work on safety and judgment and sequencing and all of the great things that we do. We're going to do it because the benefits are clear. Reduced risk of heart disease and stroke. So a lot of those health effects, they are negated if we've got a good regular exercise program in place. Reduces blood pressure, improves sleep. That's a big one. I was listening to one of my favorite podcasts out there, the Jaros podcast. They had an episode on sleep last week or earlier this week, and it was fantastic. Check it out. But I think we're just hearing more and more and more about sleep hygiene, sleep health, how important it is. But physical activity will for sure help with that. Reduced anxiety and depression. That feeling of euphoria after exercise is you can't take that away. It's a beautiful thing. No one ever regrets the workout that they complete. Like, you might kind of regret having to deal with that alarm in the morning, but you never regret that workout. You always feel good after. Reduced fall risk and injuries related to fall risk because you're building strength. So the other consequence that we need to be prepared for if we're locking people up in their rooms to protect them from spreading a virus around are a bunch of falls and fractures. Yep, that's going to happen if we don't address it and come up with a game plan to continue exercise programming, balance training, supporting bone, muscle, and joint health. Super important despite pandemic. It improves cognitive ability. So again, those people that are real unsafe, they're going to continue to be unsafe, and even worse, more unsafe, if we don't have them routinely exercising. So the cognitive abilities definitely improve with a regular exercise program. There's a ton of research on that. Reduced arthritis pain. So this is an answer for pain management. It's really been our call from the opioid crisis, all these crises. The answer from to reducing opioids and narcotic drugs to manage pain. The physical therapy services are an answer for that. To really help with pain. And then the item that I have on the bottom of my list, I have italicized because I thought it was really interesting. And I know this, but I think right now in this time, it's important to highlight that exercise plays a role in immunity. And I found some notes. And again, this was an article that was from the National Institutes of Health. So on the NIH.gov website, daily exercise enhances immune defense activity and metabolic health. There's an inverse relationship between moderate exercise and incidence of upper respiratory tract infection. So as we exercise more, that risk goes down. I thought that was really interesting, especially right now. Regular physical exercise may decrease mortality and incidence rates for influenza and pneumonia. You're building up that layer of defense inside out. It's a beautiful thing. And that regular exercise has anti-inflammatory influences. So the inflammation related to pain, joint dysfunction, where you'll see that anti-inflammatory influence go down with regular exercise. So I just thought that was a really interesting article that I read that really connects to what we're doing. Again, going back to we are essential. Like we are in it, and we are going to do everything we can to prevent the risk of spreading, but we're also going to be mindful that there are consequences of the things that we absolutely have to do. And I'm hoping that you all reach out with your great ideas to that I can share on the podcast. I'm putting together things now, and again, we're just going to be pushing out as much as we can to you guys. I cannot thank you enough for everything that you do. The team at QRM, we love you and support you. We're here for you and just want to give you everything we possibly can to enhance your toolbox and give you resources to be able to immediately use in the field. So thank you all so much. My name is Casey Lee, Quality Clinical Specialist with Quality Rehab Management. Please subscribe to the podcast, the Buzz Podcast, on the QRM website. And if you would like to reach out, my email address is clee, Lee, at qrmhealth.com. Thank you all for tuning in, and I'll talk to you soon. Thanks.